Welcome. My name is Patty Clapper. I'm a member of the Pitkin County Board of County Commissioners. I'm going to be moderating today's COVID-19 community meeting. And I wish to welcome all of the public who is participating by Zoom or watching us on Grassroots TV. And I want to introduce very quickly the speakers. We have quite a list today. We have Sam Landerkasper from Pitkin County Health and Human Services, Josh Vance from Pitkin County Public Health Epidemiology, Dave Ressler from Aspen Valley Hospital, Larissa Dandinow from Pitkin County Public Health, Jordana Sabella, also with Pitkin County Public Health, CJ Oliver with the City of Aspen Health Protection Team, Joanna Coffey, Brian Doherty, and Tucker Valton from Consumer Protection Team, Rich Berkeley, Steve Howard with the Aspen Skiing Company. So we have quite a packed agenda here. So I'm ready to get us going. But before, I want to just mention to the public, the I Wear a Mask campaign will have a landing page on the website. It's to be launched next week. It's where people can send in their own mask selfies and including a few words about why they think it's important to wear a mask. So we encourage the public to participate in this new program because it shares with the rest of the community what people are doing and the efforts that are being made. So I'm going to kick off first with Sam Landerkasper from the Health and Human Services Department. So Sam, the floor is yours.
All right, thanks, Patty. I'm going to see if I can get my screen sharing here. Let's see. Okay, is everybody seeing our cover title page for Pitkin County Human Services Mass Care and Shelter?
Yes, we are.
All right, great. So today we just wanted to talk a bit about human services and the services that we've been providing since the onset of COVID with kind of an eye towards the economic impact. And starting out, just want to highlight our normal, quote unquote, human services functions. We have our senior services, which provides meals, transportation, programming for older adults in Pitkin County. We have our protective services with adult and family services. So these are prevention and intervention programs for adults and children who are experiencing issues. We have our economic assistance programs, which are various programs including food assistance, Medicaid, child care assistance, various financial assistances. Our veteran services programs, helping our veterans with claims with the VA, as well as connecting them with community resources. And then the Healthy Community Fund, which is a $3 million mill levy funded program to provide our social safety net and helps provide grant funding to a lot of our local nonprofits. So under normal circumstances, these are the programs that Human Services is working on for the community. However, under COVID, obviously our programming expanded quite a bit as we're tasked with mass care and shelter. So meaning ensuring safe and adequate shelter and housing, providing food and supplies in mass care events such as disaster, pandemic response, coordinating our mental health response, as well as organizing those resources. Also supporting people with access and functional needs. Access and functional needs is a term used for folks who are over 60, possibly disabled, disenfranchised, homeless, unemployed, people who are experiencing difficulty thriving in everyday situations. Also enhancing youth, family, and individual well-being. And then during all of this, maintaining the continuity of all of our normal services, which obviously saw major impacts because of the increased demand that we were seeing. We just wanted to highlight really quickly some of the community partners who we've been working with in this response. This obviously isn't a complete list, but we just wanted to recognize that this is a complete community effort responding to this, and we certainly wouldn't be able to do the work we're doing without help from so many of our partners here in Pitkin County and throughout the region as well. A lot of these efforts have gone beyond the borders of the county, certainly in this response. First thing we wanted to look at and talk about was in response to COVID was our SNAP program, which is a Supplemental Nutrition Assistance Program. Many folks know this as food stamps. Obviously, with the onset of COVID in March, we saw a major increase not only in applications, but also our caseload, which also results in a lot of funds coming into Pitkin County. So just as a quick overview, if you're looking at the top chart that shows our SNAP caseload over the last 4 years, those gold bars in April, May, and June represent our current active SNAP caseload, which is just under 350 cases right now. And I believe there's around 500 individuals within those cases. I'd have to look at the exact numbers to be sure. We also saw major increases in our applications. So our staff, we have currently have 3 technicians who are processing applications. So on average, we were seeing around, about 30 applications per month. During the peak time during COVID, we were seeing upwards of 100 per month. So just a very big increase in our workload. The good news is that getting these folks enrolled in the program, the increase in our issuance, so meaning the issuance, the amount of funds going out to the community, increased from about $30,000 a month in March to over $90,000 per month in April through June. So we've seen an issuance since March of $300,000 plus in SNAP benefits, when in 2019, in the whole year, we issued around $375,000. So the good news there is that these funds are going directly to folks who are in need, to help them purchase food, and then a lot of that is being done locally. So we're seeing some of those federal funds being infused to our local economy through this program. So we've really been trying to encourage SNAP enrollment. A lot of our community partners are helping us with this. And with the federal unemployment benefits dropping off as of right now, we'd like to see, folks taking advantage of this program and getting enrolled while they can, to help bring in that additional income wherever possible. We also wanted to talk about unemployment data. Obviously, in a resort economy, that has a big impact. It also impacts how folks are accessing the programs for the Human Services Department. So if you look at the map of Colorado on the right, you'll see that, these our resort economies are some of those being most hard hit by unemployment. In Pitkin County, we are a little bit higher than our neighboring counties of Garfield and Eagle County, and obviously much higher than the statewide unemployment rate. It continues to be high even after peaking out in April. Another bit of information that we received from the Colorado Department of Labor and Employment that was interesting and good to be aware of is the labor force information. So meaning you can see here the number of our residents who are unemployed, our ongoing unemployment rate, and just showing that this is a significant portion of our population that currently is out of work. And with those extra unemployment benefits running out, we're going to have a lot of folks who are going to be experiencing difficulty with their shelter needs, their food needs, utilities. A lot of areas of their lives are going to be impacted. So in response to the major change in unemployment in March, we were fortunate to be able to stand up the COVID Emergency Relief Program. This was modeled after our emergency assistance program that was funded by the Healthy Community Fund that we've had since 2009, which provided assistance to folks who are struggling with meeting their financial needs. We obviously changed this a bit because of the situation, and we were able to successfully get funding. Pitkin County provided funding, City of Aspen, Town of Snowmass Village, Aspen Community Foundation. And over the course, we just shut the program down at the end of June. So from mid-March until the end of June, nearly $2.3 million in assistance was approved to be issued to folks who needed help paying their rent, their mortgage, various other things that were being impacted by COVID. Nearly 3,000 unduplicated individuals received assistance. over 500 households with children under 18. And, we were able to work through 4,091 applications for assistance. So that just kind of goes to show the need that was out there. 4,000 different individual applications were submitted, and we were lucky to have help from not only human services departments that didn't work with this program normally. We had help from the library, clerk and recorder, finance, BITS. Aspen Skiing Company was able to help us with this because of the massive amount of approvals and screenings that needed to be done to work through this program. So if you look at the data we have here, you can see where the issuance was handed out as far as municipality goes. The issuance type, I think, is interesting. Obviously, for the most part, shelter was the large one that folks are worried about. I think that's something we're still going to see moving forward. And then, our big months were in April and May. This was during a time when people hadn't yet received their unemployment assistance. So folks had lost their paychecks, in the middle of March, towards the end of March. And there was a chunk of time there where people weren't getting any income coming in. And this is when we saw the biggest demand on this program. So looking forward, with these unemployment benefits ending, we hope not to see quite this spike, as we know a good portion of people have been able to go back to work. But we do expect to see an increase in demand moving into July and August. So with that information, that was a lot of the response to the initial COVID outbreak and the closing of businesses and the shutdown. We wanted to look at our recovery and focus moving forward. So as a department, we are working to support the public health goals and objectives. We want to make sure that there's sustainability of our programming. All of these good programs that have been set up in the initial response, we want to make sure that they're able to continue. We want to ensure individual and family economic stability, as well as focusing on our high-risk and vulnerable populations. In order to have a good idea of what we might be looking at moving forward, we conducted a survey with all of the folks who provided an email address when they applied for the COVID relief program. That was around 2,500 people that we were able to send a direct email link out to, asking for their response to a number of questions. Overall, we received about 242 responses as of yesterday, so we were really happy to get this information. And we really wanted to look at what is going to be the need moving forward, because as of right now, the COVID relief program through Pitkin County is not accepting applications, and our community partners such as the school resource centers as well as Catholic Charities are handling a lot of these requests for assistance. So we wanted to be able to provide them with information and also look at how our program worked, some of the demographics around that. So what you're seeing here is some of our demographic info. It tells us where the respondents lived, ages, looking to see if folks have gone back to work. The good news is we're seeing that a substantial portion have returned back to work. And then also looking to see, who feels that they maybe still need assistance. So there is a substantial portion of the population that even if they are back at work, still feels like that COVID has impacted them to the point that they still do need assistance. So we know the demand is out there and is likely to increase. We also gathered a little bit of information about in which industries people were working. I think a lot of it is not a surprise to anyone, but we did want to see generally where that impact is, and obviously it's in the hospitality, dining, ski operations, the tourism aspect of our economy. So I think we already knew that, but it was still good to see that information is still relevant. And then we talked to folks about what their outlook is of their current situation and moving forward. We wanted to see how people felt about where they are right now, what the future holds for them. Did this program meet their needs? We see that folks are a little bit more optimistic about their housing stability than they are about their financial stability. Looking at questions 5 and 6, that's where you'll see that. And then we also wanted to ask people how they felt about their employment situation moving forward. And as you can see, the majority of people were feeling that they're worried about what their employment's going to look like moving forward. Probably just doing some quick math here, about 70% of the responses indicate that people didn't feel like their employment would be going back to the level it was before COVID. And then we looked at what are people doing in response to this. So asking, have you attended or do you attend the food banks? Have you applied for the Supplemental Nutrition Assistance Program? Something worth noting there is that 18% of the people, even though with a lot of messaging about the SNAP program with regard to COVID relief, there's still 18% who don't know what that program is. So making sure that, we can get people in touch with those benefits is very important. We asked what type of assistance they felt best met their needs. In most cases, it was the shelter, and asking if folks applied for unemployment benefits. So as you'll see here, 64% of the folks applied and received unemployment. Once again, going to this issue of the extra weekly payments going away and what kind of impact that's going to have on our residents and the economy here starting next week, really. We were also working with our community partners. We were able to stand up a number of food pantries. So what you'll see here is we have food or meal information from the senior center. We had a food distribution at Aspen High School and Basalt Middle School, and then one in Snowmass Village. So the senior center has been delivering meals and having folks pick up lunches from the senior center since they shut down. Aspen High School and Snowmass Village are mobile pantries managed by Aspen Family Connections that have been going on. Aspen High School's weekly, Snowmass Village has been bi-weekly. And then the Basalt Middle School pantry has been managed by Aspen Skiing Company, and that's been weekly. Most of the food is coming from Food Bank of the Rockies. And then starting next week, the Aspen and Snowmass Village pantries are going to be combined into one that's going to be housed at the Buttermilk parking lot. So as you can see here, we've had pretty consistent access to these food resources throughout the entire response. Generally, it's around 1,500 households per week that are coming through these pantries. We haven't seen any major downturns. So our goal as an organization is to make sure that this resource is stabilized and is there for the duration of this response, making sure that people are able to access this. And we're lucky to have such great partners as Food Bank of the Rockies and Lift Up to help make sure that those food resources are available.
Sam, you need to start wrapping up, please.
All right, I think I've got two left.
Okay,
so,
perfect.
Right here, we've got social supports for older adults. So the Senior Center has really shifted their programming to make themselves accessible in a virtual format, making sure that people aren't suffering from isolation, making sure that folks who maybe aren't as mobile are able to get food delivered to them as well as groceries, and are able to make trips out for appointments, medical appointments, things like that. A lot of their information can be found on their website, which is on here, and that's a great way for people to connect. And then going back to our homeless and our AFN, access and functional needs population, in response to the increased needs we were seeing, case management has been expanded. So if you look at the bottom graph, that's these are AFN, so adult access and functional needs referrals. As you can see, there have been some pretty substantial spikes in April and July. And at this time, the entire adult and family services team is responding to these requests, helping with case management, making sure that non-congregate shelters available for folks who maybe are homeless but need to isolate due to COVID quarantine. And then also the establishment of the safe and outdoor space at the Intercept lot, maintenance of that, making sure that the services that are necessary are available to those folks, and that it's a safe place for people who don't have a place to live right now. And that's all I've got.
Thank you very much, Sam. We appreciate it. That's a lot of good information. So next we have Josh Vance with Picking County Public Health Epidemiology. Vance, the floor is yours.
Okay, so I'm going to touch on our current numbers, and then Dave Ressler is going to jump in after me and give an update on the hospital.
Perfect, thank you.
So right here we have, these are our current cases that have been reported, I'm sorry, not current cases, our total cases that have been reported since March. You'll notice again, as we've just discussed in the past, we had a peak here in April, cases went down, and now we saw a peak here in mid-July following the 4th of July holiday. And now we've begun to see a slight decrease in cases, but we're still seeing a heavy amount of cases being reported each day, on average about 2 to 3. This red line here is our 14-day running total of cases. So at any given point, it'll tell you how many cases we've had in the past 14 days. So if you look at today's total, we've had 31 cases reported over the last 14 days, and that's remained pretty consistent over the past week or so. In total, we have 164 cases, and since July 13th, our contact tracing team has reached out to 185 people to discuss potential exposure to COVID-19. This is a similar graph just showing you the cases by their date of symptom onset. What I wanted to highlight here is that this blue line here is July 4th. You'll notice that we had a lull here with not many cases. Following July 4th, we began to see a slight increase in cases, a pretty significant curve here. And then it's sort of curving down again as well, but we really don't know about this time period right here. We're still waiting for those reports, and these might increase. But I just wanted to point out that these main holidays, or major holidays, seem to be pretty significant in terms of disease transmission, and we saw that here in Picking County. These are cases by city in Picking County. So of course, Aspen is seeing the most cases by sheer number. We've had 20 reported in Stonemass Village, 14 in Basalt, and then the rest of our cities have seen less than 5 cases in total since the beginning of the pandemic. Looking at cases by employment status, and I don't want this one to get confused, this isn't where the people were exposed, this is where they work, or where they state that their employment is. We considered or included retired here in this metric. That's the highest percent, is that individuals who are retired appear to be most affected here in Picking County by COVID-19, which mimics national and worldwide data, showing that older people tend to have higher risk factor for COVID-19. Restaurant and grocery was a closely followed retirement, as did retail and hotel. And so we're seeing a significant number of individuals who work in those sectors who are being infected, whether that occurs there or outside of the place of employment. And then the last thing I just want to touch on real quick is there's a lot of research going on right now, and a lot of interesting findings are being presented. And so I just wanted to share this one with the community. This is a study done in Germany. They looked at 100 patients that had COVID-19. They looked at their heart while they were infected, and then about 3 months later, they looked at their heart again to determine if there was any sort of impact to their heart. And what they found is that in 78 of the patients, of those 100, they noticed that they had abnormal findings, meaning that they were finding some sort of damage done to their heart. Some of them were less severe, some were more severe, but on average, when you compare this to people that did not have COVID, which is the individuals down here, you'll notice that these individuals had higher levels of heart damage than those who were the control group. So I just wanted to point this study out. It's just one study. It was a small study. I don't want to generalize it to our entire population, but we are finding a lot. We're finding a lot more out about COVID-19 and maybe the chronic and long-term effects that COVID-19 can have. And so I think it's important for us as a community to really stay on top of that and to be mindful of the fact that while this impacts people in the acute short term, it's also having long-term effects on individuals as well. And so it's important for us to really keep on the data and the research and to really understand the long-lasting effects that COVID may have. So I'm going to hand it over to Dave Ressler.
Thank you, Josh. So I'm as Josh mentioned, I'm going to talk to you about the hospital status. And we have some good news to share today, along with a word of caution at the same time. The good news is that, as you can see, this is a screenshot of the current website and the matrix that we maintain on that website indicating the status of our hospital capacity. And you may recall that back in June, we increased or escalated our status on the far right column from comfortable to cautious. And so we had a yellow cautious in that middle category of average daily visits. And as we discussed on our previous community forums and in other opportunities, that was specifically related to one of the three types of services that we provide in that category, which is community testing. So as you can see, we look to a threshold of 16 or less community tests indicated by the abbreviation CT. And for the period of time back in June and early and mid-July, we were exceeding that on an average daily basis looking out over 14 days. However, for the last 14 days, we have been below 16 tests through our community testing center here at the hospital. And for that reason, we were able to return back to comfortable with the understanding that our respiratory, we still call it the tent, it's now indoors, but the respiratory tent, or what we call the respiratory evaluation center, has been running less than 10 per day, and our emergency department is continuing to see less than 6 per day on average, and we look at 14-day rolling averages. The cautionary note that I want to offer, however, is that we are just below these threshold levels, particularly with our testing. We're still testing 13 to 15 patients a day, and so we're not far below this threshold. And our emergency department has seen an increase. We were seeing about 1 to 2 highly symptomatic patients, and now we're seeing 3 to 4 on average per day. So we certainly don't want to send the message of complacency, because that is far from the reality. Let me talk a little bit more on the next slide, Josh, if you would please, about testing itself and what we're seeing there. This is, well, thank you, Josh, is a snapshot from the website. Many of you are observing this, I'm sure, on a regular basis, if not daily. And there's some good news in this chart as well. You can see for the weekend in July 26th, that is the last data point on the x-axis of the graph. And the important line to look at here is the yellow positivity trend on a 14-day rolling average. And you can see that it actually decreased in that last week to, if you hover your pointer over that data point, you'll see that we're down to, I think it's 6.3%. So over, 6.63% over a 14-day rolling average. That's good. That's dropping down from what we were concerned about, which was, as you can see, we were approaching the 10% mark. If you hover over each of the data points for those preceding weeks, you'll see ranges from 7, 8, 9%. Overall, over the course of our testing, over the months now, we're at about 7% overall. But again, over the past few weeks, we have been approaching 10%, which would indicate a concern both in terms of the amount of testing being sufficient and the rate of the viral spread. Josh provided much better data about that a minute ago. So from the hospital standpoint, from a capacity standpoint, at the present time, we're comfortable. We don't have a single patient in the hospital today. We had one that came in last night into the emergency department, by way of example, that was sent home with a negative test. So we are not seeing the spike in the hospital that we've been concerned about. culminating from the information Josh was conveying about the 4th of July holiday and the positive test results that followed that. We were concerned that a couple weeks, we're now entering 4 weeks, post that period of time, we would start to see a demand or a surge in demand on hospital services, and I'm happy to say that that hasn't been the case. So what does that mean? We believe that we are doing the right things as a community, and this is a message to double down and not back off. Don't let off the gas. Thank you to the city for creating the zone, the mask zone. Thank you to all of you for adhering to the 5 commitments to containment, keeping your distance, keeping your face coverings on, washing your hands, staying home if you don't feel well, and getting tested if you and your physician think you might have COVID. It's working. The other part that's working is what Josh just explained, the containment, the box-it-in strategy, the tracing process. Thank you, thank you, thank you, thank you to all of those hardworking people over at Pickens County Public Health, our partners. And thank you to our community members. It's working. Let's keep it up. That's the message. Keep it up. Keep up the good work, and we are going to be able to sustain our ability to keep our community thriving without imposing too much demand or surge in demand on the hospital. That's what it's all about, and ultimately saving lives. So let me talk a little bit more about testing, because that, as you're reading about in the state and national media, is also a local dynamic. And that is because of the surging number of cases in communities across the country, particular states across the country that we're reading about, Texas, Florida, Arizona, et cetera, testing has become a limited availability for all of us now. So we are working, and this is the good news, our 3 counties have always been partnering around public health, Pickens, Eagle, and Garfield counties. And similarly, the 4 hospitals in these 3 counties are working with our counties and with each other to develop and implement a regional testing strategy that is consistent among all of us, all of our communities and all of our hospitals that are providing testing, and other sites that are providing testing as well in these communities. And so we are focused on symptomatic testing. We have rapid tests available at the hospitals, but we are reserving these because they're in the most limited supply. We only receive so many supplies to support our testing in the hospitals for those patients that are the most symptomatic, and those patients that are referred by the county as being critical to containment, like in outbreak situations. That is where we are reserving our rapid tests for. Up until a couple weeks ago, all of us hospitals were providing those tests more liberally for anybody that had symptoms, and we just can't do that anymore. We are instead utilizing send-out testing, or in our case, saliva testing, for those individuals that are asymptomatic, that are traveling, or think you may have been around somebody that was positive. But if the county determines that you have been exposed in the tracing process, you will be referred to us for that testing, and when appropriate and requested by the county, we may use a rapid test for those. Otherwise, it will be the saliva test. So please, if you are traveling or you have other reasons to be tested, there are many. Talk to your physician, receive a referral to Aspen Valley Hospital. If you don't have a physician, contact our primary care practice, particularly if you have symptoms, and we will schedule to have you come in and get tested. And again, I'll conclude with, in a manner consistent with all of the hospitals in this region. That's from Rifle to Vail to Valley View for ourselves. So that is my update for today. I believe I've used all my time, and I appreciate it. And if you have any questions, I'm happy to answer them.
Thank you very much, Dave and Josh, and you guys actually gave me 1 extra minute, so I truly appreciate that. Next, we have Larissa Dandinow with Pickens County Public Health. She's going to speak about our latest and greatest mask ordinance. Welcome.
Good afternoon. Thank you. I wanted to spend some time to just briefly go over the mask requirements as they kind of continue to change, to make sure everybody has a good understanding of where we are with wearing masks. So right now in Pitkin County, the current requirements are that you have to wear a mask when you're entering or moving within any public indoor space, and or while using or if you're waiting to use any public transportation service or non-personal transportation service, such as ride shares or buses, and of course while outdoors when maintaining a physical distance of 6 feet from another person who's not of the same household isn't feasible. And you'll notice that that 10-minute time frame has been removed. So that means that when you're outdoors and you can't maintain that 6 feet of physical distance, then you have to wear the mask regardless of how long that interaction is. So what does all that mean? I know it can get kind of confusing, so I want to share with you some specific scenarios about when you should wear a mask. So if you're outdoors exercising, whether it be passing on a trail and you can't stay 6 feet from another individual, then you need to have a mask on. If you are exercising in an indoor gym facility, even if you're exercising by yourself, you're still in an indoor public space, so you need to have a mask on. And then also in all common areas, such as elevators, hallways, break rooms. Of course, if you're seated in a break room and you need to consume a meal, you can remove your mask to consume your meal during that time. So there are times when it is perfectly safe for you to remove your mask, and that is if you're working in an office with the door closed, you can have your mask off. But if someone does enter into the office, we ask that you put your mask on during that interaction. And then outdoors, if you are outdoors and you are away from other people and more than 6 feet from other individuals, please feel free to take off your mask and enjoy the beautiful outdoors that we have here. And then while seated at a restaurant, if you do have to get up to go use the restroom, go speak to someone at another table, if you're moving around within the restaurant, you do need to have your mask on. But while you are seated at a restaurant, it is okay to have that mask off. So for businesses, what does this mean for mask compliance? Businesses are required to post signs at entrances that instruct customers that they must wear masks when entering or moving around inside the business. And if a customer claims to be exempt for a medical condition or another reason, you are not allowed to ask for proof of the condition that they have that allow them to be exempt. So what does that mean too? If someone does claim to be exempt, well, there's some best practices that you can consider when you come in contact with those kinds of instances. So consider implementing alternatives to in-person service, maybe curbside pickup, contactless delivery, or assistance with certain services and products online. And then if a customer attempts to enter without a covering, try and communicate with them first to make sure that they understand what the requirements are. And if you have the availability of face coverings to provide to customers, then do so if you're able, and then request that they put it on. If they continue to refuse to wear a face covering, then you are required to decline services to the customer or request that they not enter or they have to leave the premises. But of course, we want to work with customers as well as we can. So if they are a visitor and aren't necessarily aware of the requirements, then first share that information with them so that they understand. That is all I have on masks. I'll pass it over to Jordana next.
Thanks, Marissa.
I forgot about this one. Sorry. Sorry, Jordana. I wanted to mention really quick, Dave mentioned it earlier, but the Aspen mandatory mask zone, this is effective as of tomorrow, and within the zone specified there, you are required to wear a mask in all indoor and outdoor areas, with the exemption if you're in a motor vehicle or if you're seated for dining. But keep in mind, this is regardless of if you're with someone of the same household or even if you are 6 feet from somebody, those do not come into play here. So you have to have a mask on at all times within that zone except for those two exemptions. Now I'll pass it over to you, Jordana.
Thanks, Larissa. Welcome, Jordana.
Thanks, Patty. Thanks, Larissa. I'm Jordana Sabella with Pitkin County Public Health, and
I'm happy to talk with you today about the new guideline going into effect today around informal gatherings. So as of today, informal gatherings are limited to 10 individuals. The reasoning behind this restriction is really we've been learning from the investigation team about where spread is happening in a lot of cases, and it's during these informal gatherings, barbecues, folks getting together. And so we're really trying to take this data to inform our public health order and our restrictions to prevent the transmission and spread of COVID-19 in the community. So what does this mean? We still are allowing some events of up to 50 people to occur, those that are these more formal kinds of gatherings and planned events. And so if you're asking yourself, I have this event in mind that I'm planning, where do I fit? Is it an informal event? What does it require? What do I need to do? You can go to the website and reference this chart. So it'll walk you through, if you've got an event you're planning to have that has up to 50 people, requires a city, town, or county permit. You'll need to file an event safety plan and submit your permit application, and that is still permitted to occur. If the event is more than 10 people, up to 50, doesn't require a permit, you can think through these next 3 steps. So is it going to be hosted in a commercial space, so a hotel ballroom, somewhere that already has a facility event safety plan? If that's the case, that kind of event is still able to occur up to 50 people. Does the event have a coordinator with a business safety plan on file? If they do, this is what they do. They're an event coordinator or some kind of business who hosts or runs these kinds of events. They would just need to file an event safety plan to have that kind of event occur. But then if the event doesn't have a coordinator with a business safety plan on file, your event is going to be limited to 10 people or less. I think what's important to understand here is knowing that the event coordinator is really a professional with that business safety plan on file who is responsible for the event safety plan compliance as their primary role during the event. So that's really their responsibility to make sure that all of those social distancing and hygiene and masking requirements are being met and maintained throughout the event. So we thank you for adjusting to this and recognizing the importance of all following these guidances and guidelines as we continue to hopefully see that trend line bumping down over time. And I will pass that on now to Brian.
Thanks, Jordana, Larissa. So I wanted to just introduce our new consumer protection team that we are just recently sending out into the field. We've got them all trained and feeling comfortable to go talk to businesses. So me, Brian Doherty, am managing this team. I've lived in Aspen for about 12 years and love exploring our backcountry backyard, mountain biking and skiing and running, and just feel like this is a really important part of this community. And so we also have Tucker and Joanna as our 2 specialists that will be going out in the field, responding to complaints, and then also making general visits to all business types just to ensure that they're following the guidelines as required. Tucker moved to the Valley about 8 years ago from Washington, D.C., and is a really big sports fan, has a really strong customer service experience, and really enjoys being a part of this small community and really getting out there. Joanna Coffey, born and raised local here in Aspen, really big skier and surfer, really likes to go hiking, and the really deep community ties to our area. So I just wanted to introduce everybody to these folks that you'll be seeing out around the county and as well every once in a while in Aspen. Aspen as well will have their own health protection team which will be run by CJ Oliver and Natalie Pezdos. And they will have 2 staff members. I believe one has accepted that offer at this time, and they're waiting on acceptance for the second one. So we can move on to this next slide. And I just want to take a second to appreciate what Mitch and Laura and Linda have done for the city in this meantime while they've been trying to hire these folks. They've done a really great job hanging in there. So for our team, the goals of what we're trying to do to make sure that every business has submitted their COVID safety plan and that they're following these requirements within. So this has been a major challenge for us currently, is just getting that outreach out to every business type and that's out there, and making sure that they're aware that they need to have this plan and that they need to know what's inside it and what they need to be following. So we're either on the phone and also in person going out to these businesses to work with them to help them understand these guidelines, and especially for each specific business type, because each business is going to be slightly different, whether they're retail or an office setting or a restaurant or anything above. We're trying to make sure that we have uniform messaging for all the businesses. So when a patron does go to a restaurant, they are going to have the same experience that they would have at any other restaurant in Pickens County, with no exceptions. And same with retail, as far as when you're walking in, you're wearing a mask. You're wearing a mask at all times unless you're being seated to eat while you're indoors. And lots of other things like that. Another portion of our job is going to be responding to these community concerns and complaints, and we're trying to do those as quickly as possible and investigate those. And lastly, though we feel that our most important role is education for these businesses, it will end up possibly going into enforcement actions, which have been drawn out for businesses that have not been in compliance and have been refusing to make corrections that we have recommended that they correct in order to follow the public health order. So we can go to the next slide. So I just wanted to talk a little bit about our complaint system. So we have this website. If you go to Pickens County's website, there's the bar across the top for COVID information. When you click that, it brings you to this page. And right at the top of it, we have report a public health violation. And if you click that, it brings up a form that you can fill out to specify where that violation occurred and what observations you saw and things like that. So we can go out and respond to those complaints because the county is large and we cannot be everywhere at once. We need the community's help to let us know where there are issues. And if there are serious violations, we would consider a serious violation something that is willfully and blatantly against the public health order, something like a large, like 150-person party in a restaurant, or people dancing and doing all kinds of things without masks inside a building. Those would be some things that we would want the police to respond to immediately, and that is that number for the non-emergency line listed. So the way this is working is that initial complaints are split up, and they're either going to my team with Pickens County for the outside of the city limits of Aspen's jurisdiction, and the ones that are located in the city of Aspen are being forwarded to the city's team for initial contacts. As the progresses through the processes and they do need to have enforcement, enforcement is happening through Pickens County, so we will also be in the city of Aspen doing enforcement actions and business visits, as well as the city's team. Both our team and the city's team are focused on issues with businesses. We see that it's a real big challenge to try to chase somebody down not wearing a mask in a park or on a trail or something like that. and while we do appreciate those complaints, just to make us aware of where these potential issues are happening for us to possibly have more enforcement or signage, we are available to immediately respond to those type of issues. Our goal is to complete these investigations within 24 to 48 hours. So, oh yeah, so if you click again, there's gonna be another one that slides across. So we're talking about that, one more. There it is. So business plans. So you saw on that last slide, just below where you submit the complaint is business safety plan. When you click on it, it brings you to this page. And obviously you click on this portion to submit your business safety plan. Again, I want to reiterate, all businesses that are open in Pickens County need to have a business safety plan submitted. And along with that business safety plan, there are specific industry guidance that needs to be met as well. And I have a brief list on the side here of the different industry guidances that we have created. And when you get onto this business safety plan page, if you were to just scroll up, you would see links to every single one of these pages. It was just too large to fit on the screen. But I want to remind everybody, we're still seeing a lot of businesses that do not have these business safety plans. And it's really important for you to be able to understand what requirements you're being held to as a business. And so we know that you understand when we are coming to these businesses to talk to you that you've done your due diligence of what you're supposed to do. That's about all I had for this.
Okay, thank you, Brian and Jordana and Larissa. You guys are moving along. I really appreciate it. CJ, with the City of Aspen, did you have some comments you'd like to present to us?
I do.
Thank you.
Let me bring this up. All right, so one more click away here. I kind of want to follow up briefly on what Brian had touched on, which is a number of the functions of our Aspen Health Protection team. But our group is a small group of city-specific staff that are handling many of the issues that Brian talked about inside of the City of Aspen city limits. And so our group is focused primarily on education and business support. Our main goal is to keep businesses compliant and up to speed with whatever the sector-specific guidance that relates to their business is. We're going out and doing visits both in response to complaints as well as a lot of proactive visits to City of Aspen businesses to make sure that they have a firm understanding of what the requirements are related to their business, and if they don't, providing that guidance to them. And also, as Brian mentioned, we're really working hard to try to make sure that our City of Aspen businesses are in possession of a business safety plan that's applicable to their business sector. So that's really been the focus of our team. The graph up here kind of shows a breakdown of some of our bigger areas of focus. Restaurants obviously being a big component of that, just because of the number of visitors, the number of restaurants, period, as well as general retail, gyms, educating about our mask ordinance out on the street, and a host of other smaller bits and pieces that kind of make up that pie chart. Our group is currently made up of a number of people who are working on this effort part-time, because they're also employed as community resource officers and parking department directors and a number of folks. And as Brian had mentioned, I want to repeat, we're very grateful for their efforts. They've been able to do a lot. In the last month, we've conducted over 120 site visits and community contacts out in the community with that staff that are devoting a small sliver of their time to be able to make that work happen. As we move ahead, we're going to be hiring 2 full-time staff to work on this, so we're going to significantly increase our capacity to be out in the community and have a presence, and hopefully be able to get to compliance and make sure that we have business safety plans at businesses in a more efficient manner moving ahead, because that will be our 2 new employees' primary focus. I don't yet have pictures of them. One of them is hired and will be starting work on the 6th of August, and the other one we're still working out some details on. But basically in the next 2 to 3 weeks, we're planning to have significant more capacity in the City of Aspen and really help to support the efforts that Brian and his team are doing across the county our folks aren't going to be handling enforcement actions specifically, but our team will be providing documentation for violations that they observe out in the community, and we'll forward that on to the enforcement team that's handling those actions. So our team is really kind of an Aspen-specific addition to the work that Brian and Jordana and all of their teams are doing over in Pickens County, and we're just focused specifically in the city of Aspen. And that's about it for me.
CJ, thank you very much. Okay, now we're leading up to the Aspen Ski Company with Rich Berkeley and Steve Howard, who are going to speak to us about steps the ski company is currently taking during the pandemic to plan for next ski season. So gentlemen, the floor is yours. Hi, Rich. Hi, Steve.
Patty, thank you. So yes, first of all, let's just restate that our overall goal is to operate in a manner that protects the safety of guests, employees, greater community, and meets and exceeds all of the public health directives. We completely understand that we cannot operate if there's a spike in hospitalizations, and Dave, I was very pleased to see that it looks like we are accomplishing that goal. Before I start, I want to just do some quick rumor control. I'm hearing that we were not going to open all of the mountains either due to business or to bees, and that is false. We are planning on opening all of our mountains as we have scheduled, and Kaplan and I have been known to run lists if need be, so we will continue to do that. Rumor confirmation. We are in this dichotomy of where we're hearing that we're going to be too busy at certain times and not busy enough in, say, January. January is going to be significantly impacted by a lack of international business. We are expecting international business to be almost zero. And so we are aware of that, and we're working on steps to kind of modulate the season, address that a little bit further as far as how we're going to do that. We don't know how other markets are going to fill in, but we do believe that Houston, Los Angeles, Kansas City might become drive markets. All of our on-mountain projects are on schedule. So snowmaking to the top of Aspen Mountain, the burn chair and snowmass, snowmaking on log deck, log pole, and snowmass, and then the sun deck roof should be all complete with no issues. Next week, we are putting on a new rope on the Lift 1A chairlift, so you'll see that project in town if you're there. For planning purposes, we've divided this planning into 4 teams and areas of operating. There's external agencies and communications, operations planning, which probably is what deals with you guys the most, product and programming changes, and then technology and communications. For external agencies, you are one of them. County Health Board meetings now become must-see TV. But we also are working with the governor's office, monitoring what their thinking is. We're also working with Colorado Ski Country and NSAA to develop a playbook for the pandemic, ideally so that the entire ski industry has a unified front moving forward from Oregon to Southeast for ski areas so that we're not all fragmented. One of the areas that has become very important to us, which wasn't really on our radar even 3 weeks ago, was school districts. If the school districts are not in session, a huge impact both to our employee workforce, and then probably those kids will want to be on the hill at some point, and that's a congestion area as well. We're also working with our ancillary partners, Challenge Aspen and ABSC being the others, the big ones, but we also have about 100 other ones. And we're watching very closely what's going on in Eagle, Summit County, as you guys are, because what impacts Vail Resorts probably will come to Pickens County at some point. We're looking at ski area operations in South America and Australia, New Zealand. New Zealand currently leading the world in terms of how they're operating, but it's an island, it's closed, and it's all locals, and they have no confirmed COVID tests or cases. South American resorts, for the most part, haven't opened. We're also watching amusement parks and shopping malls, since they're similar in nature to how we operate. Most of them are operating at very, very severely limited capacity. Most malls are still closed. And then we're keeping an eye on nationwide trends. We are very aware that we do not operate in a bubble. What happens in the community and then even in the state will certainly impact our ability to stay open. So we have these divided into those areas, and we have teams working on each one. I'm on all of them. There's one currently meeting right now that I'm missing, so I'll get an update. Operations planning. If you probably noticed, everyone puts a timestamp now on operations. They say as of July 1st at 1 p.m. or whatever it is, and that's exactly what I will do. We've been in operation 55 days so far, and it doesn't look like, I was very pleased to see Dave's report on the hospital, which is our #1 goal, as it stated, and we would like to continue that track record. So we're looking at every aspect of our operation from a kind of a pinch point and we're developing protocols for each department and area, geographic and department, the functionality. We're going to reduce the need and access for locker rooms, just so you all know. So you'll see a lot more employees in uniform before we can let you commute in a uniform or ride the bus. And we are compartmentalizing teams where we can, so that if we have a positive case, similar to what happened in the school district yesterday, we can quarantine that group without impacting the entire operation. Our biggest pinch point, believe it or not, is turning out to be transportation. And so we had a meeting with RAFTA and Dan Blankenship, and with the buses at the capacities they're at, we're going to be at a huge impact for both our employees getting to work and for guests getting to the mountain. So we're anticipating that we're going to see a lot more drive traffic. We don't have a lot of capacity in parking. Not sure how that's going to look. We're working on expanding anywhere we can for parking, but we're also looking at expedited curbside drop-off, and any way that we can expand our fleet, we'll certainly do that. Ticket offices you've seen. I hope you guys have been by the Aspen Mountain ticket office and inspected it, and that it's functioning as well. The lessons that we're learning from summer operations will certainly apply to winter, and monitoring line flow seems to be the key there. Rental retail is in the similar boat. We actually have 2 retail operations open, one in Aspen and one in Snowmass, and we're applying those. But what we're looking at for the winter will be anything that's touchless. Home delivery, reservation systems, touchless waivers, outside payment and pickup and drop off, so those types of things. Rental retail certainly presents another pinch point, and so we're watching that. Mountain food and beverage is our third biggest pinch point. Limited capacity currently. We're probably focused on a lot more grab and go type menus. We will have, I don't think we're going to have any sit down dining on Mountain next year. We're expanding spaces. We're tenting where we can. We're reopening facilities. I'm working with the team from the county under Suzanne Wolf to look at roofing. Spider Savage at Snowmass very well becomes a restaurant and a tent. Cafe West at the bottom of Buttermilk. Every little warming hut becomes a picnic area. We're going to have picnic areas all over the mountain. So think of Buckhorn Cabin is expanded in a socially distant format. Top of Total Lock Park. Highlands, we'll do Buttermilk, we'll have some there at the bottom of West. Bathrooms and warming facilities is our other big concern. And we're obviously with capacity limits on the buildings, we're going to have bathrooms outside, but warming facilities is of concern, and we're going to be certainly communicating with both locals and guests on how that looks. Lift operations. First of all, if we have the epidemiologists on the line, we would love to get as much information outside and socially distances what we need to do. But we're creating as much space as possible throughout all of our areas. We're trying to spread pulses throughout the day. So you guys know that on Aspen Mountain, for whatever reason, at 11 o'clock, we always have a line. Even if at 9:30 we didn't, and at 11:45 we don't. And that we're going to try and do everything we can. We are looking at spreading pulses both throughout the day, throughout the weeks, and throughout the season. So we may be asking locals to ski a lot more in early December than in the holiday season. We may have other capacity constraints limitations in place as well. We know capacity is going to be limited. We don't know how much, and we hope it's not zero. It's kind of what we're trying to do everything to prepare for. Gondola cabins obviously will be parties that know each other. They'll be disinfected on every turn. That's currently what we're doing right now. And we are probably going to be looking at changing local skiing habits. So you may ski 2 creeks on afternoons versus other areas that you would normally do on a Saturday morning. Products and programming, and this is the biggest unknown, and here we feel that the longer we wait, the better idea we have of what we can actually offer for guests and locals. We've already delayed selling season passes till September. That could go beyond that, depending on how things look. No decisions other than that have been made at this time, but everything is on the table. Weekday passes we're looking at, staggered ski school, blackouts, validations, incentives to ski mountains, so maybe skiing Buttermilk over Snowmass on certain days. But we recognize that skiing and snowboarding are fundamental to everyone in this valley, and our goal is to be as fair and as equitable for all users against all capacity constraints. And again, I reiterate, no decisions have been made. The group that I alluded to, that's the products and programming team, is meeting right now, and we're going to be hopefully having answers here in the next 30 days or so. Another area is technology and communications. And technology, we're going to try and do everything we can to prioritize, advance everything: sales, registration, waivers, fulfillment. Doing touchless credit card transactions. We have touchless menus in all of our restaurants. We have text pickups so that you can come grab and go without touching anything. We're looking at tech to monitor crowds and lines and some way to get that to the guest so that if you knew that, like, for instance, Highlands on a Saturday powder morning, probably not the best way to go, but we'll certainly get real-time information out as far as how crowded it is. Communication, this is the last thing, is going to be key. And I talked to a couple people at the county to see how the county does their text alerts, but some system along those lines that we can send it to a large body of people in a very short period of time, real time, so that we can control where we're creating congestion. Philosophically, we're looking at as many portals as we can. We're a very lucky resort. We have 13 base areas. And so we're probably going to be opening, for instance, 2 creeks as early as possible to relieve pressure at the base of the VX or the gondola. Campgrounds, Lift 1, all of the areas that we have that we can spread people across the mountains. So letting guests and employees know what's going on is critical to any of our plans working. With communications, keeping this group, the County Health Board, informed of our plans that basically change daily. I'm more than happy to present to you guys on whatever schedule works for you in the future. But as we start to solidify some of these, I'll be happy to get back for you. And then lastly, we are really committed to providing as much skiing and snowboarding as we can. We know this is not going to be a normal season, and we're going to start asking for patience, flexibility, and understanding, because there's going to be a lot of changes, and it's definitely not going to be business as usual. And we're doing everything we can to achieve that first goal, which is keeping the medical system free, protecting our employees and locals. Patty, that's a record.
Good job. Good job. And we understood every word you quickly said. I think I need to reach out and thank the ski company. I know this is a big deal for the community and for many reasons to have a ski season. And I can't even imagine what the ski company is going through trying to figure out all these complex issues. But whatever Picking County can do and whatever the city of Aspen can do in Snowmass, I know this community will be glad to work with the ski company to see what we can do to help out and how we can encourage people to be flexible, patient, and understanding. So thank you all. So in closing, I believe I can close now, Tracy. I again want to thank everyone for joining us today. I want to thank all of the people who spoke and for their concern and their patience for timeliness. And I think we can close the meeting unless, Tracy, if you're still here, if you have anything more you would like to add.
No, you guys were fantastic. Thank you so much. If anybody has slides they want to share with us, you could email those to me at tracy.truelove@pickingcounty.com, and we'll include that in our recap. So thank you so much.
Great, thank you all, and Grassroots, thank you, and to staff who's helped us, I want to thank you, and so we will be signing off. Until next week, thank you all.